Okay. Well, good afternoon, everyone. I'm Jim Rooney, President and CEO of the Greater Boston Chamber of Commerce, and on behalf of the entire Chamber team, we hope that you are joining us today feeling safe and healthy during what I know is an unprecedented time for all of us. During this time at the Chamber, we seek to be a source of information, a convener, and an advocate on behalf of the Greater Boston business community, but really in this time for all of the citizens of Greater Boston in addressing the challenges that we face together. We're in a phase now where the discussions have shifted to moving forward, shifted to conversations around what does reopening look like and how will all of that happen. And we're certainly hearing from many of the employers, I'm sure represented on this call, as well as their employees, about what will commuting be like. We've talked to many employers and surveyed a lot of our members, and foremost in their minds is commuting, is childcare, and testing. And those are certainly issues that we at the Chamber are focused on. So today we're going to focus on the commuting aspect, and we're joined by 6 very thoughtful people who will help guide us through a conversation about that. The way this call will work today is we're going to break it into 2 parts. And the timing is very good because I'm sure everyone on this call knows that Governor Baker has set up a team of people as a reopening task force. And one of our panelists today, Secretary Stephanie Pollack, is a member of that task force. She's joined by General Manager Steve Poptak. So in the first phase, we'll hear from Secretary Pollack and General Manager Poptak, and then we'll transition into a panel discussion. And I'll introduce everybody in just a minute. Before that, I want to give a big thanks to the 2 co-chairs of the Chamber's Transportation Leadership Council for their work in keeping these conversations going year-round, and especially during this time in which people are indeed looking for information. And they are Katie Lapp, Executive Vice President of Harvard University, who will moderate the panel discussion later, and Mike Scott, a partner at the law firm of Nutter. I want to flag that today's webinar is being recorded. And finally, please submit your questions through the chat feature on your screen or by emailing Chamber Programs at bostonchamber.com, Chamber Programs, one word, at bostonchamber.com. So with that, I'm pleased to introduce today's speakers and panelists. First, as I said, we'll hear an update from Secretary Stephanie Pollack and General Manager Steve Poptak. These are 2 people that I think are known to our audience quite well. But Stephanie Pollack is the Secretary of Transportation of the Commonwealth of Massachusetts and CEO of MassDOT, is both head of MassDOT and a board member of the Mass Port Authority. Secretary Pollack brings years of experience spanning all aspects of the transportation business. As I said, joining Secretary Pollack, we have Steve Poptak, General Manager of the MBTA, who has held this position since 2019. Previously served as Executive Director of the Rappaport Institute for the Greater Boston at the Harvard Kennedy School. After we hear from Secretary Pollack and General Manager Poptak, we'll transition into a panel discussion. Our moderator, as I said, for today's panel is Katie Lapp, Executive Vice President at Harvard University, a leader of many talents. Katie has backgrounds in law, higher education, and transportation, and has managed operations, finance, and business strategy for North America's largest regional transportation network, the New York MTA. Participating with Katie on the panel is Kate White, Planning Policy Practice Leader at ARUP. Kate brings with her 25 years of experience in sustainable mobility and development, and is known for having championed innovative public policy programs and projects. Next, just so that we cover the region, not just the city of Boston, we have Monica Tibbetts-Nutt, Executive Director of the 128 Business Council. Monica's areas of specialty include urban design and transit equity. In addition to Monica's day job, Monica serves on numerous boards, including the MassDOT Board of Directors, and serves as vice chair of the Fiscal Management and Control Board that currently oversees the MBTA. And finally, we have Tracy Zen, president of Zipcar. Tracy has 20 years of experience in technology roles at consumer technology companies. Now as head of the world's leading car sharing network, Tracy is focused on innovation and leveraging technology to grow the company's position in the mobility industry. And as I turn it over to Secretary Pollack and General Manager Poptak, I want to note that we have about 1,000 people who've registered for this call, which is the largest of these calls that we've had at the Chamber, topping the previous record set by Federal Reserve CEO Rosengren. And I'm reminded that he was asked a question, and I'm paraphrasing on his call, when will we know when we're out of this crisis? And his answer was, when everyone is comfortable riding the T. So with that, and no pressure, Secretary Pollack and General Manager Poptak.
Thank you, Jim. That's, as we're going to talk about, may mean that we're going to be in this crisis for a while, because we know from some data that people are not necessarily feeling uncomfortable. Hopefully, we can make people a little more comfortable. But thank you for pulling this very important panel together on a topic that obviously all of us are thinking about. For all intents and purposes, there hasn't been a lot of travel, let alone commuting, since we all went into stay-at-home mode. But we know that that's going to change, so the timing is really excellent. If you could just go to the next slide, please. The general manager and I are going to kind of tag team this one. And the first thing that I want to sort of start with is what's changed and what hasn't changed when it comes to thinking about how we are going to come back into travel and specifically into commuting. So next slide, please. So we all know that one of the things that has changed is the amount of traffic. Just a few months ago, although it may be hard to remember, the biggest issue on the radar screen at the Massachusetts Department of Transportation was congestion and the ways in which it was sapping our energy, our economy, and in many cases, our patients. And we were really focused on what we were going to do about congestion. Now, of course, we have discovered that a pandemic is a very fast way of getting out of congestion, but not the way we would like to. So obviously, traffic congestion has disappeared, and one of the questions that we all have is how fast is it going to come back as we start to reopen the economy? And I'm going to ask you to go to the next slide and ask the general manager to talk about what's been happening on the transit side.
Great, good afternoon, and thank you for the opportunity to address this group. What you see visually here is what we will show in a second in numbers, but what you see here is significantly lower ridership across the system. I would draw your attention to in the bottom right corner, you can see some seats that we have stickered, asking people not to use those seats. Those happen to be the seats on the Green Line trolley that are closest to the operator. So that has been an attempt to create physical distance for the operators. If we could go to the next slide, what you'll see there is a visual representation of how ridership has dropped over time. It's dropped quite precipitously. You can see throughout March, we've got 3 big milestones there. One would be the declaration of the state of emergency. On the 17th, closure and gathering, limitation on the size of gathering, as well as the MBTA's reduction in service from full service levels to kind of a Saturday plus service that we put in place. And then on the 24th, the closure of non-essential businesses. I draw your attention to a couple things on this chart. One would be from roughly from March 10th to March 17th. You can see some lines dropped fast, some modes dropped faster than others, with the blue line and bus in particular being the last ones to really drop off. It took them kind of a couple more days to drop off. And then if you look all the way to the right of that chart, you can see where ridership has been the most durable. We're running about 20% of our baseline ridership on bus. We're running about 18% of our baseline ridership on the ride. And then the blue line has bounced around at about 12 to 13% of ridership, a typical ridership, whereas the rest of the rapid transit system is about 6 to 8% in terms of its actual ridership. So I'll hand it back to the secretary if we can advance to the next slide.
Thanks, Steve. Another big change that I'm sure we're going to be talking about with the panel is that we had been in the midst of a huge growth spurt in various forms of shared mobility, including but not limited to transportation network companies like Uber and Lyft. Part of our congestion debate in Massachusetts had been about the extent to which those services might be contributing to particularly congestion on local roads. The governor had proposed an additional fee on TNC companies, in part to help fund some of our transportation needs, but also in part to send a signal that they were part of the problem and needed to be part of the solution. While there's not a ton of public data, it is pretty widely reported that particularly the passenger side of the Uber and Lyft business has gone down by that same 70, 80% that we've also seen in overall traffic and on the transit system. But as we'll talk about throughout this conversation this afternoon, it's not just where the numbers are while we're all home. It's going to be the willingness of consumers to go back to a mode of transportation that maybe doesn't feel the same way when we're worried about the coronavirus, because you're now talking about stepping into someone else's vehicle and relying on them to be following the appropriate, health-based protocols. And so there's some data, as there is data with respect to transit that we'll be talking about, that a reasonable proportion of the people who were making generous use of shared mobility modes certainly won't come back at the beginning of the reopening and may not come back. So that's another thing that's changed, and we don't know how much it's going to stick. Next slide, please. The other thing that you can't really separate the issue when you talk about commuting, you can't separate transportation issues from workplace issues, because commuting is, of course, the process of getting from where you live to where you work. And so one of the most substantial changes that we've all seen and most of us have experienced is the change of where you work from a workplace like an office or a laboratory or a store or a restaurant to your home. And what that does is something that we've talked about a lot as transportation professionals, but done very little of, is what it's changed is that your commute is to not commute. It's become known as work from home, or WFH. Massachusetts was not a state that did a great job of work from home. There's some data on the lower left of this slide that indicates that we are in the middle of the pack on states in terms of the percentage of total workers who report working from home as their primary mode of getting to work. I'll show you some data later from the Boston metro area compared to other metro areas. So we've really gone, and we had started a conversation about more telecommuting as part of the congestion report conversation. And I have to say, honestly, that last year when we were talking about work from home as a congestion solution, we got, I would not say an overwhelmingly positive reception, that it was a serious solution to congestion. And now, all of a sudden, all of us have experienced for weeks on end the process of working from home. And while there are plenty of people who are eagerly looking forward to getting back to their workplace, there's been a far higher acceptance of telecommuting and a far higher sense among both employers and employees that it is, in fact, a productive way of getting work done. So you can't talk about commuting without talking about the extent to which people are going to continue to be moving from a home to work site, or are they going to be working from home, or, as most people seem to think, is there going to be some combination of the two? But in any event, I think one of the things we do all expect is that there will be more work from home, certainly in the early stages of the reopening of the economy and the recovery, in part because of continued concerns about the coronavirus. Next slide, please. So I also want to talk for 1 minute about what hasn't changed, because that also helps frame our conversation this afternoon about commuting. And what hasn't changed for us at the Massachusetts Department of Transportation is what the function of a good transportation system needs to be. A good transportation system needs to be safe, and historically that has tended to focus on things like reducing crashes and protecting people's physical safety. But in the era of COVID-19, our definition of safety obviously needs to expand to address people feeling safe, whether it's on the T or as they move around for any reason in any mode of transportation. So safety is always job one in transportation, but a good transportation system needs to do more than that. Another key thing that we started talking about a lot about the time the congestion report came out was the system has to be reliable. Whether you're traveling by transit or you're traveling by your car, you want to know that you're going to get where you're going in a reliable manner. The system also has to be accessible, meaning that it provides people with access to the things and places that they want to get to. It needs to be sustainable and resilient, and I'll talk about that for one more second on the next slide. And we also need a system that is equitable, and equity means a lot of different things to a lot of different people. Equity may mean a system that works whether you live in the city or a suburb or a more rural part of Massachusetts. Equity may mean that the system needs to work for you no matter what your income is, your physical ability is, your ability to drive, lots of different things. And equity really is one of the issues that is coming to the forefront as we move through the coronavirus pandemic, because we're seeing every day how inequities in our city and in our region are affecting how people are or are not able to successfully navigate our new normal around coronavirus, and it also needs to be part of our discussion about commuting. I just want to touch on one more thing on the next slide that hasn't changed. It's mentioned briefly on this slide, and that is that we still need to, as we redefine what the new normal is on commuting, we need to address the reality that transportation sector greenhouse gas emissions are still the largest and fastest growing source of greenhouse gas emissions in Massachusetts. They've obviously come down during this period where we're not doing a lot of driving. They're pretty much proportional to vehicle miles traveled. So vehicle miles traveled are down 70 to 80% across the state, which means that our emissions are down, which is great as far as the state hitting its 2020 target. But in the longer run, as driving comes back, we still need to get to net zero carbon emissions by the year 2050. And it is mathematically and practically impossible to do that without taking a hard stance on transportation greenhouse gas emissions. So we've continued to work with our fellow states in the Northeast on the Transportation and Climate Initiative and on other initiatives that are designed to lower greenhouse gas emissions. So when we talk about the commute of the future, it has to be a sustainable commute as well as a commute that people can feel safe undertaking. So that's the framework that I wanted to present for the rest of our conversation this afternoon. Now let's move to the next topic and the next slide, which is what I am referring to as the Goldilocks challenge, which is how can we get the new normal for commuting to be just right? What do I mean by that? Well, on the next slide, what you'll see is that a big debate that's been going on in the transportation world as we've started to think about moving ahead is the concern about sort of the role that transit is going to play and how much commuting and travel is going to happen on transit as a mode as we come out of the stay-at-home phase of our coexistence with the coronavirus. Too little transit is a problem. If we don't have enough people making use of the MBTA transit system, that's bad for traffic. That's bad for greenhouse gas emissions. I would argue that it's bad for equity. Certainly, it could be a sign that our riders aren't feeling that we're doing the job that we should do on safety. And riders produce fares, and fares are an important part of the financial support network for the T. So sort of like the Goldilocks story, if it's too little or too cool, transit isn't good. But because of the reality that people are and will continue to be concerned about social distancing as one of the key strategies for trying to avoid getting and passing along coronavirus, we also know that Unfortunately, too much transit, particularly transit that is crowded, may prove to be a problem for commuters. It could present safety issues to MBTA employees and to our riders, and it could actually send a signal to riders who are already anxious about getting back on the T, that they want to get off it because they are going back to the crowded commutes that maybe they've forgotten about, but they will quickly remember about since they were only a few months ago. So the Goldilocks challenge is, how do we get it just right? How do we make sure that there's enough transit so that we're addressing traffic congestion, greenhouse gases, and equity issues, but we make sure that that transit isn't crowded? And so I am going to ask the general manager to talk through the next few slides, because one of the key points that we think is important in talking about getting people back onto the MBTA system in appropriate numbers at the appropriate time is confidence in the safety of the system. So general manager, I'll turn it over to you.
Great. And if we can just flip to the next slide. What you see on this slide is a visual representation of a very extensive cleaning and decontamination regime that we have in place at the MBTA. Obviously, we are cleaning stations on a daily basis. We are wiping down the major touch points in the core rapid transit stations every 4 hours. If we switch to the next slide, you will see a kind of a more extensive listing of the things we are doing. We're also cleaning our facilities on a daily basis, and we have brought in outside contractors to do much of this work. The T has spent over $30 million, basically from a standing start in the middle of March, on not only cleaning services, but also PPE to clean vehicles, our facilities, our stations, and also protect our workforce and riders. If we can go to the next slide, beyond the cleaning and decontamination, one of the key elements of our regime here to make sure to stop the spread of this virus is, one, protecting our workforce in two ways. One is we have conducted temperature checks. At this point, we're almost up to about 15,000 temperature checks that we conduct on a rotating basis for the workforce as they come into work. We have also tested close to 900 members of the workforce for COVID-19. So you're talking about a base of 6,300 employees. So we've tested a seventh of the workforce. We have also, and this has been a challenge, but we have been able to, over time, procure personal protective equipment for our employees. These include masks as well as individual. This is my little prop here. The MBTA got into the sanitizer business. When we were unable to actually buy sanitizer, we were able to buy it in bulk. We were able to buy these little bottles, and our industrious mechanics filled them, and we got them out to all of our frontline workforce. So they had this equipment. So that has been that has been an important part and will be an ongoing part. Not only the cleaning and decontamination, but also the protective personal equipment on an ongoing basis. We have budgeted over $1 million a week in the upcoming budget to continue this program. So folks should have confidence that we are doing, in my estimation, we are doing as much as any transit agency in the country is in this regard. However, the secretary now is going to talk about folks' attitudes towards transit.
So I think just from, for those of you who are employers, from talking to your employees, for those of you who may be employees or consumers, just thinking about this and talking to your friends, there's a widespread concern, perhaps embodied by what the Fed chairman said, about a lot of activities, but one of the ones that is of the greatest concern to the population seems to be the idea of getting back to transit. The data you see on the left of this slide comes from a Suffolk University Boston Globe poll that was published earlier this week. Well, we're not on the slide. If we could move to the next slide. What we see is that when we allow the reopening, whenever that happens later this month, whatever we allow, this poll tells us that 4 out of 5 people in the poll would not get on the T. after there's a treatment, but before a vaccine, we still see less than half of the poll respondents saying they are ready to get back on buses, subways, and commuter trains. Now, this poll talked to people who maybe were not regular transit users before, so a more interesting data set comes from a poll of 25,000 U.S. consumers that was done in April and released by the IBM Institute for Business Values. And they specifically asked people who identify themselves as regular users of transit how they felt, and 20% of them said that they no longer would use transit at all, and another 28%, so again, more than half, said they would use it less often. So on that Goldilocks sort of seesaw, this data makes us worry that we might not get enough transit riders because of people's continuing fear about the safety of the system, no matter how hard the T works to make it safe. Next slide, please. And one mode that we're particularly going to be following to understand how people's attitudes have changed is commuter rail. Commuter rail has basically evaporated as a mode of transportation in Massachusetts. We're at 1% of our ridership. The trains that used to look like the picture on the left now consistently look like the picture on the right. And this is after a sustained period of growth between 2012 and 2018 that was pretty much uniform across all of our transit lines. But we know that our transit rail users are more likely to be in jobs where they can work telecommute from home and more likely to have access to a car and potentially a parking space. So I think it may be a while before we see commuter rail coming back in particular. Next slide. The problem is, while in the immediate short term, there's no problem with transit riders sort of slowly getting comfortable and coming back to the system, and it will certainly help with the crowding end of our Goldilocks challenge. If everyone who was using the T gets in their car, that's going to wreak havoc on traffic in the greater Boston area. We know this for a fact because it actually happened in 2015 when we had an extended shutdown of parts of the subway system and parts of the commuter rail system after a bad winter, and we saw our roads choked with traffic. So this is an analysis that was recently published by some researchers at Vanderbilt University that looked at all the major metropolitan areas in the United States and modeled what would happen to traffic and travel times if 1 in 4 transit users didn't come back, half of transit users didn't come back, 3/4 of transit users didn't come back, and all transit users didn't come back. And as you can see in this table, Boston is one of the most affected metropolitan areas in terms of the number of additional minutes of drive time that we would experience. It's not nearly as much of an issue in the Worcester area, if you look at the chart, because they don't have a very high transit mode share to begin with. Next slide. So the bottom line on sort of predicting how transit is going to come back is really that we don't know the answer. We're not going to know what's going to happen until it happens. And so one of the hallmarks of the way that MassDOT and the T are going to have to operate in this new normal is we are going to have to be flexible. We're going to have to be adaptable. We're going to have to do a lot of data collection, data analysis, real-time monitoring. When we see, if we see that the riders are not coming back, we're going to have to do more to see what we can do to bring them back, working with employers and the other people on this phone call. If we see that in some parts of the system they're coming back too fast and we're seeing crowding, we're going to have to do something on the supply side to reduce it. But I would not hazard, no matter how hard Jim asked me, a prediction on which way I think we're going to go. Is it going to be too little, too much, or some of both? Because I think we really aren't going to know until we start to reopen the economy and people have the opportunity to come out of their house and decide if they want to use the T again. The last topic that we wanted to, I know we're a little over time, so Steve and I will try to get through these slides quickly, but we wanted to touch on sort of how the T is approaching reopening, and then end on the topic of how the way people work is going to affect the way people commute. Steve?
Great. So let me talk a little bit about the T, and if we could advance to the next slide, I'm going to pick up the secretary's final point from her previous slide. We're going to start with safety. We're going to start with making the trips as safe as possible by providing what we consider a best-in-class disinfection and cleaning regime. The other thing is we have, we are attempting to balance in fiscal year 21 the demands to provide the same level of service that we provided last year with a much lower ridership base. And I think, the challenge there is that the definition of crowded has changed greatly. We use a standard of 86 passengers on a Blue Line car during rush hour to define that sort of maximum capacity. That's crowded. I think sort of in a post-COVID world, 86 folks is probably not going to be acceptable to most of our riders. So we are beginning to analyze what our capacity is with much less crowded vehicles. And the point I want to make is that we have put the funding in place in the FY21 budget to run full service with the expectation that we will be running it for fewer riders, but riders who will want to have less crowded commutes. If we can go to the next slide, one of the areas in particular where we are paying careful attention to is the bus system. As I noted before on the ridership slide, buses are still carrying about 20 to 22% of capacity. The subway's carrying about 8.5% of capacity. And then it's not even across bus routes. Certain bus routes have only declined. For instance, the 28 bus route is still carrying about 30% of ridership. The 111 bus is carrying about 25% of ridership. And I think, one of the signs of this, we would call it the durability of ridership, is that these are folks who are really, they are dependent on the bus and they need to use it. So we are, we are in the process of analyzing different scenarios to try to think about what we need to do to make sure we have enough capacity out there. I'll end this slide with, if we get back to 50% of our baseline ridership, and again, we're at 22% now, and we're putting in place a standard here for the sake of analysis, a standard of 20 passengers per bus, rather than the typical 53 that we use. 9% of all weekday trips would be considered crowded, and that is something where we're carefully analyzing where we have capacity issues. Part of the thinking around dealing with capacity issues, if we can go to the next slide, is to think about what are ways where we can deliver more supply. It's difficult for us to deliver more supply in terms of the absolute number of buses because we're somewhat limited, not only in the number of buses, but at least in the short run, the number of operators we have. So what are things we can do to provide more service? One is to think aggressively about dedicated bus lanes. And we've started a dialogue with several municipalities. This may be the moment where we can put bus lanes in place, particularly at a time when there is less traffic, and really demonstrate that they work. So that is one of the ways that we are thinking about it. If we can go to the next slide. We're also thinking about how do we monitor ridership? How do we put in place the operational flexibility that we can respond to crowding, that we can respond to higher levels of demand? And also, how do we think about ridership, and how do we think about durability of ridership? I think one of the clues to durability of ridership is, those routes that either haven't gone down as much or went down more slowly are the places where we're going to allocate. We're going to attempt to allocate as much capacity as we can. So with that, I will turn it back over to the secretary.
So I hope that the takeaway from the general manager's discussion of supply is the T will do everything it needs to do to give riders a safe ride and to supply as much transit as we can with the vehicles and the employees we have, even while we are expecting a relatively small number of riders. And thankfully, we have Federal CARES Act money to kind of bridge that gap, since we obviously won't be collecting a lot of fares. But if you could go to the next slide. What's also clear is that as the economy comes back, and given the concern about the traffic congestion and the sort of one end of the Goldilocks spectrum, we need not to just depend on the T. There's a collective partnership effort that we all need to engage in, including many of the employers who are members of the Boston Chamber and other business groups, in thinking together about the future of commuting, which also includes the future of work, so that we can make sure that the capacity that the T can safely carry and convince our passengers that they are safe and that they are not crowded is enough for the people who really need to use transit, who can't work from home, who go to workplaces where you have to be physically present to do your job, and who don't have the option of commuting. That's really what we're trying to provide capacity for, and what we need help from the business community in doing, if you could go to the next slide, is working through a series of what I would characterize as demand side solutions. What can we do to change if people commute at all, which is telecommuting, when they commute, which could be staggered work hours, if there are alternatives to using transit that are not driving in cars by yourself, whether that's biking and walking for shorter trips, or carpooling or vanpooling in safe ways for longer trips. Where we have crowding on one part of the system, can we introduce supply on another part of the system? We were able to do that early in the pandemic when we saw a lot of activity on the Blue Line, and we realized that because we had parking at Wonderland, which is not usually the case, some of our North Shore healthcare workforce who couldn't take commuter rail because we didn't have early enough trains were driving to the Blue Line. And the way we actually were able to address that was we started running more trains on the commuter rail from the North Shore that arrived in time for shift changes at the hospitals. And so commuter rail has traditionally seen its sweet spot as 8. If it's true, as the general manager pointed out, that the peak moves earlier when we're looking at more of an essential workforce, maybe we need to change our commuter rail schedules, because as you saw from the pictures, we've got capacity there. So there's a lot of strategies we can use, but many of them are not things that MassDOT or the T can do by themselves. And probably the most significant of those, next slide please, is reinventing working and not being the place that we were before the pandemic when it comes to telecommuting. One of the statistics that I used consistently when I used to go around and talk about our congestion report is that you would think with a knowledge-based tech economy that we would be a national leader in telecommuting, but this is data from 2017, and what you can see is that we were maybe at 4% as a Boston metro area in telecommuting, which is less than half of Boulder, Colorado, where 10% of all the people telecommute, and also only about 2/3 of the Bay Area, which is very similar to us in terms of its employment mix and the total workforce. And so what the little red circles represent is that at that time we had about 137,000 people working from home, and the Bay Area with the same size workforce had 160,000, which means we had 23,000 more people on our roads every single day than we needed to if we were just doing as well as the Bay Area, if we can do as well as Boulder. And now that we have essentially half or more of our workforce successfully working from home, the question is, how do we make that durable? And next slide, please. There's a lot of good reasons that maintaining work from home well into the reopening and recovery of the economy may make sense, not just from a transportation perspective. The workforce seems to be signaling that it likes that and that it will address its anxiety. The workplaces in the Boston core, particularly the office places and the high-rise buildings, would also benefit from fewer people on any given day to deal with elevator space and social distancing in workspaces, especially the kind of open workspaces that tech is known for. We think it's consistent with employee preferences. We think it's consistent with allowing people who are at higher risk to be at home and not have to expose themselves to the risk. And most of all, we think a lot of people have enjoyed not spending part of their day commuting. So we really look forward to working with the Chamber and other business groups and the employer community to see if we as a region can take the learnings from this pandemic period and really realize some of the benefits of increasing the amount of work from home, not just to relieve pressure on the MBTA system, but because there's a lot of other good reasons to do it. I think the next slide's the last slide. And the message there is just, we talked about at the beginning about sort of the before, which was kind of the one end of a Goldilocks choice in which we were really dying every day from the amount of congestion and crowding on our transit system. And in the now of today, there's so little travel that that's not a good place to be either, because it also means there's not enough economic activity going on and there's not enough mobility that people really need. And that future is a giant question mark. We don't know how to predict it, but I think where I would end is to say what we do know is there's a lot of ways to change the way we work and the way we commute if we're all working together and if we're open to trying new things, and if we want to sort of land on that sweet spot in our Goldilocks challenge and find the commute of the future that is just right for us here in Metro Boston. So thank you for listening to the general manager and I'm going to turn it back to Jim.
Okay, great. Well, thank you for that informative presentation. It was chock full of information, and I know that in the chat box there were a lot of questions and compliments about the details that were included in that. Unfortunately, we're only going to have time for 1 or 2 questions, but I think in terms of this partnership, Secretary Pollack, you'll find that the business community is way ahead of you, thinking about all of the transitions to how work will take place in the future, talking a lot about this issue of work from home. They've stood up many systems involving technology that want to enable them to do that, and a lot of that is going on in a robust way, and look forward to that continuing dialogue. I think a lot of the questions we're getting, and you're involved in the advisory board, is sort of some definition. You use the phrase that the T will put out as much as we can in terms of service. I think the question on people's minds is when you will be able to give some more specificity to that in terms of what will the orange line look like, what will my bus route look like in terms of service levels, in terms of how many people will get on it, and how that operation is going to take place. What's the conversation like, and when do you think you'll be able to share some of that information?
So I think there's 2 sides to that. Obviously, everyone is waiting with bated breath for the the advisory board on reopening to give our recommendations to the governor. And I want to assure people, folks are hard at work, spending hours every day, including Saturday and Sunday, engaging with the different groups. I think that the message that we have heard from pretty much every presentation, including the one by the Chamber, is that we need to put health first. And if that means that we need to have a cautious, phased, slow at first reopening of the economy, then that is what we should be doing. So I don't think you should be surprised to hear that that's going to be the messaging that you're already hearing from the governor and the lieutenant governor, and you're going to hear from the committee. That said, the T is not running less service primarily for financial reasons. It's running less service because there's no justification for it, and to sort of husband its workforce. And so we're coordinating very closely with the T and the general manager. And as I said, we've set up their budget so that once it is clear that we start to see the ridership come back on the transit side, the T can go back to the schedules that it used to run all the time as soon as it's necessary for those schedules. And the T can also turn up the key bus routes first, but keep the commuter rail down. So I think rather than the T kind of announcing some schedule, it's really going to be a much more iterative process of monitoring where ridership is going and then adding to the schedules to the point where we build back up to the full schedule. I would hazard a guess that the T will need to be back at its full schedule by the time schools open up again in the fall. But as I said, we've got the financial wherewithal to do that sooner if the ridership justifies it. So that's kind of how we're approaching it. There's not going to be a giant plan that the T is going to release that is going to tell you exactly how much service they're going to have on every service every month for the next 12 months, because that's not how it's going to come back. And again, all the data we have from the companies you've mentioned, which are thinking of keeping people at work, and from the riders who are telling us they may not be ready to get on the T, is that I think the summer is going to be kind of a slow ramp up for transit ridership.
So I'll end this section with a comment and a question for the general manager. And the comment is that I hope that you will share with all of the employees at the T that are working that they received a virtual standing ovation from this session for being out there on the front lines. I know that they're really first responders in this moment. So Steve, please share that gratitude on behalf of Greater Boston business community to your entire workforce. And along those lines, just comment on the people side of it today, and as you prepare for sort of the plans that develop for reopening, you know, operators, mechanics, You know, is that a limiting factor, or is that something that, you know, you'll have adequate resources for?
You know, I think that is, you know, that is potentially a limiting factor, and it's something we're going to have to manage through. I greatly appreciate those good wishes you just shared, and I share them as well. You know, everyone who's making the T go, particularly those folks on the front line, have really done. You know, we keep saying this is not what most of these folks signed up for, right? Like, they did not expect to be playing such a frontline role in terms of getting essential employees to work, and they're doing that, and they're doing it magnificently. We have had over 140 cases of COVID-19 in our workforce, and you know, that is obviously something we need to manage through, because for every active case, you also have folks who are on leave, some folks who are caring for family members who are ill, some who are because of contact tracing, are being quarantined for a period of time. So working through that is going to take some time, and is one of the factors that affects our ability to provide service.
Right. So let me express my gratitude to Secretary Pollack, General Manager PopTac. There are some questions in the queue that we just won't be able to get to, but maybe in the coming weeks, we'll come back and do this again when this is a situation where the information changes hourly. And as you said, Secretary, it's a dynamic process and iterative process in which decision-making gets changed. So so maybe we'll come back sometime in the next couple of weeks or a month, and we'll have an update. But thank you both for sharing your time today. And with that, we'll conclude this portion of the panel, and I'll turn it over to Katie Lapp to have a conversation with our expert panelists about their thinking on the whole issue of commuting. Katie?
Thank you, Jim, and thank you, Secretary and General Manager PopTac, for that amazing presentation. I thought it was just a wonderful kind of summary of the challenge that all transportation systems will be facing across the country and the globe. So I thought the label that was put on it, the Goldilocks challenge, of all the various pieces that need to be really thought about, and then the fact that it's a collective process. It's not just the T, and it's not just the highway system. It requires employers and employees to work together. The concerns of people accessing public transit, as was discussed, if they get into their cars, we'll have congestion, you know, at peak levels, and then we obviously hope that remote work will take root in the Commonwealth more so than it has today. I just thought we'd open up the conversation, ask each of you, with your strategic thinking backgrounds in transit and transportation and strategy development. What did each of you think about that presentation and your reactions to it? So why don't I start with you, Monica?
I thought it was very interesting, and I think it really highlighted a lot of the challenges that we have as a transit system and as an industry. I think the thing that has become very clear is that this is a moving target. This is a constantly evolving situation, and I think a lot of us are playing a little bit of catch up. I think at the Business Council, we engaged an epidemiologist at the end of March. And so we've kind of been working through this, really getting a better understanding of how we keep our operators safe, how we keep our riders safe. And so I think from an industry standpoint, we're going to have to keep pushing that. And I think from the information the Secretary and the General Manager went through, it's very clear we're going to have to keep pushing that, because I think the industry has put out guidelines for what is reasonable to ask of a transit agency, but that is still not what is ideal. And so I think that we're going to have to keep pushing that, and just having very real conversations and being very open to working with the business community, because I think they are really leading the way in how we're going to integrate everyone back. And it's going to be really important that the transit systems and transportation options are responsive to that. So I think that is going to probably be the biggest next step for us.
Thank you, Monica. Kate?
Yeah, I appreciated a lot of the points that the Secretary and General Manager made in terms of looking forward and how to use this time of essentially no congestion to think differently about Telecommuting, I think that was definitely came out clear that that is an important partnership with the private sector to really, many of us in the transportation sector have been dreaming about telecommuting for years and talking about it, but now we know it actually can work. And here we are, you know, on this Zoom meeting between, you know, Zoom and Teams and all these technology tools. I think we're really seeing that it can work. And so it could be much higher than the 4 or 5 or 6% that the secretary showed across, even, you know, beyond the 10% of Colorado. And then also the reallocation of road space. I appreciated the general manager talking about that. I think there's lots of opportunities for kind of pop-up temporary experiments on dedicated bus lanes, but also dedicated bicycle and pedestrian areas, and that other cities are doing, and that Boston, you know, could emulate, especially as, you know, summer is approaching. So I really appreciated a lot of those kind of looking forward solutions to our commuting challenges.
Thank you, Kate. Tracy.
Yeah, I think I can, you know, speak for the business community in the sense that, you know, we've all been forced to rethink about our telecommuting strategies, and I think in a matter of days and weeks as opposed to months. So as Zipcar, we were lucky in a sense that we had a fairly flexible policy around telecommuting, and we had the tools in place. So it's interesting because we did a dry run even before the stay-at-home orders came in place, and we never went back. So I think many others that, you know, CEOs, that when I speak to them about, you know, I think the new normal of teleworking, work from home will be in place, which I'm really excited about, because I think that, you know, we've seen that productivity hasn't really been impacted significantly at all. And I think providing employees with flexibility is really important, and not only during time of crisis, but I think in general around, you know, I think the stat that Harvard Business Review put out recently was that Americans spend on average 200 hours a year commuting. And most of that's done in a personal car, 3/4 of that's done alone. So I think, you know, the implications around the lower commuting and impact of sustainability in the cities will be really, really important. And maybe this will be the step change to kind of lower emissions and sustainability that we've all been looking for. You know, at Zipcar, we've always had a very, you know, our mission is to enable simple and responsible urban living. So for us, you know, our view was always, you know, take away personal cars, use shared access vehicles like our service, and that has a greater benefit around the society as a whole. So I think, yeah, I'm really excited to see us move the needle on the 6% on telecommuting, and also just in general sustainability and emissions overall that the secretary talked about. And I think the other trend that we're seeing as a business is also, you know, it's sort of on the flip side of, you know, lower commuting, but that we're seeing also demand for dedicated access vehicles go up, which is, you know, kind of all the data that the secretary presented around sort of the discomfort with public transit is certainly seen in our business as more and more of our members are asking for services that are available to them on an exclusive use basis. So, you know, there's sort of a balancing act of that. But I mean, you know, in general, I think you'll see more mobility models emerge coming out of this new normal.
Great, thank you, Tracy. Monica, in your role as part of the MassDOT board and the Financial Management Control Board, obviously you've been steeped in a lot of the things that we've been discussing and thought deeply about it. Are there certain areas of concern that you in particular have, given your expertise, that you really want to focus on and make sure that as they get that balance, that Goldilocks challenge right, that you really want to make sure that we have a real attention to?
Yes, equity. Equity is the absolute most important thing that we need to be thinking about, because for a lot of us, we have the luxury of being able to work from home. We have the luxury of being able to work from home for potentially months and months and months, but for a lot of our workers, that is not an option. A lot of our frontline employees, it's not an option. A lot of people that work in portions of the service industry, it's just not an option. And from a financial standpoint, especially in Massachusetts, it can be incredibly expensive to own a car. And so if you do not have that option, public transit is all that you have. And so for us to be responsive to those communities, we have to ensure, to the best of our ability, the safety of those riders, the safety of those employees. Because the thing I fear the most is we talk a lot about teleworking, we talk about all the different technological ways that we can address dealing with the coronavirus, but that leaves out a really, really high percentage of the population, even when you're looking at the bus ridership and looking at how great that still is. That is an indicator that there are still a significant portion of the population that needs this. And my concern is, if single occupancy vehicle is your only option, or some sort of rental program is your only option, trying to get the industries and trying to get the economy back in order is going to be virtually impossible, because you're going to have so many different employees who don't have that access. And a lot of these communities were already hurting before this, and a lot of these communities had already had a lack of transit access. And that has always been a huge equity concern. And I think everything that's happening in our society right now is making that even worse. And I do worry that with everything else, all these massive, massive challenges, these financial constraints, that is going to get lost. And so from not only the DOT side, but from the transit side, and in my role at the Business Council, that is the biggest thing that we're thinking about, the vulnerable populations. And even when talking about paratransit, that is something that has actually not come up a whole lot in the conversation, is how do we build protocols for those who are not as able-bodied? How do we make sure that we're not leaving them out? Because from a health standpoint, they need to be using that service to get to many of the medical appointments that they need to get through this period. So equity is my number one focus right now, and will continue to be so.
Those are very important issues. And Tracy, I was wondering, from Zipcar's perspective, how have you tried to make sure that your services are available to people who really can't afford a car and might be concerned about getting onto public transit in the current environment? Are there things that you're doing to address some of the issues that Monica highlighted?
Yeah, and I think Monica's highlighting a really important sort of broader societal issue. And I think the crisis has really kind of brought to fore some of the most vulnerable populations. And what we've done even before the pandemic is we've always believed in the great partnerships with public and the private sector. So for example, in New York, we've partnered with the New York City Housing Department, where we've offered our services at a severely discounted rate on sort of public housing sites. So that's been sort of our kind of partnership in New York that's been working really well. And I think we're constantly looking for opportunities such as the one we have in New York to really kind of make mobility access accessible, not just for, for everybody. I think that's one thing. I think in the crisis, as a membership model, we kind of find it's really an important role for us to support our community of members. We've lowered our prices significantly during the crisis to make our services more affordable. We offered new pricing models so that it's cheaper to kind of get to point A to point B without paying sort of like a fixed, sort of a more variable rate. We offer significant discounts to healthcare workers, especially those on the front line, who may feel more safe getting into a dedicated vehicle using our service. And we're also hearing from our members that they more and more they want access to a vehicle where they may not be able to afford buying a car or leasing a vehicle. That our service being flexible, you can rent it for an hour if you want to, if you need to, or for the day. And we've actually just launched a new product called Dedicated Access Zipcar, which as a response to our membership sort of request to offer a more longer term rental period for a week, 5 days. So I think we're doing all we can to also to make sure that it's easy to join Zipcar. We just launched an instant access tool where you can just sign on through the app or online and get driving within minutes. So these are all the things we're trying to do to make it easier and more accessible. But equity is certainly something that's been sort of on in our minds for a long time.
Thank you, Tracy. And Kate, your background not only in transportation and public policy really focuses on sustainability, and obviously you've indicated that you hope that the remote work experiment that we're all living right now takes root across the country, and that we can reduce the greenhouse gas emissions coming out of commuting to work. I know, thought about what other countries have been doing, China, parts of Europe that are slightly ahead of us with regard to dealing with the pandemic, and some things that you may have noticed that other cities are doing in those countries as they start to reopen, particularly focused on commuting and transportation.
Yeah, I think it's really important for to look at global cities and how they're handling reopening. And I know Boston has a number of sister cities around the world. I think I know our general manager here in San Francisco talked to our sister cities in China over the last week to get some best practices. So I encourage, you know, and it sounds like, you know, from the general manager today, there's already so much that's being done on the cleaning front, which is great. But you know, if there can be some more concerted effort, just touching on, you know, back to Monica's point about making sure that transit is safe for essential workers first and foremost, and also for the workforce. One thing that you know, Boston I know has talked about for some time, but really it's maybe a time to institute, which is proof of payment service, so that you pay before you get on and you're not, you know, interacting with the driver at all. Maybe you even, you know, pay in advance on an app on your phone, and it's just proof of payment rather than having to interact with anything, touch anything. So those are some kind of technological solutions. Also, I did really appreciate that, you know, you mentioned sustainability, and I appreciated the secretary talking about not losing sight of the net zero carbon emission reduction goals that Massachusetts has by 2050. And so transit is absolutely going to have to be a key part of that solution moving forward. And so, you know, there was a story in the last couple of days about if everybody, you know, or even a few more people get back into cars or switch to driving, then we're going to see, you know, a big increase in vehicle miles traveled and emissions. And so making transit safe, I think, you know, there is a role beyond just the transportation sector. There's a leadership role on the state level from the governor on down that I think, you know, maybe there's some lessons learned even from here in California about what are the criteria and the specific data points. Make sure there's data-driven decisions based on science and availability of, you know, hospital beds and ability to test, and, you know, what are the decision points to make sure that people can get back to transit and commuting and get back to their lives. So I think those kind of data-driven decision making is key for Massachusetts, and I think it seems like a little bit from afar, it looks like it's a little bit unclear what everyone's supposed to do. Here in California, it's crystal clear. If you're going out, you must wear a mask, and everyone's doing it. And so I think, and, you know, we're bending the curve, and so I think, you know, Massachusetts should be maybe a little more direct and clear with the public about what we all collectively need to do to be safe.
Monica, as you reflect back on the last couple of weeks and doing your work at the 128 Business Council, what has surprised you the most in terms of the adaptability or the creativity of your group, and how do you see that playing out over the next couple of months?
I mean, my group has been amazing. We have a wonderful staff. We have wonderful operators, wonderful vendors. I would say the thing that was most surprising is how little we knew about the depth of cleaning that needed to be done to make sure our systems are safe. There needs to be 4 layers of cleaning of all of our surfaces. The amount of protection our employees need, the ways that we need to change how we board passengers, how we have passengers waiting at bus stops. Everything is completely different. And I think we had a lot of frustration because I think at the federal level, there's been a lot of resistance to be too prescriptive. And so we felt like that was just leaving way too much room. And so I think that was the main focus for why we wanted to work with the medical community. I think one of the things that a lot of people have been focusing on is PPE and how hard it has been to get to PPE. And so for us, it was also reaching out to places that we wouldn't normally reach out to. And so we started engaging health professionals, started engaging health providers to be able to get this stuff in, because I think the main focus has been, well, everyone needs masks. And that was kind of it. Oh, we need to be wiping things down more. And that was kind of it. But it just wasn't enough. We needed to change the way we're cleaning. We need to be using different products. We need to understand how those products should be used. Because I think a lot of people don't understand the contact is so easy to transmit coronavirus that if you think about it, like if you're at home, have you ever read the back of your Lysol container? Have you ever read about your Lysol wipes? Most people hadn't. I never had. And we needed to figure out down to the minute how much time our cleaners needed to be spending and thinking about every movement that our operators make, from using the restroom to taking a drink, and our riders. How do we protect our operators from our riders? And then how do we ensure that our riders not only social distance, but have masks on? All of these different things. And so it is incredibly prescriptive. We have redone the entire operations, the entire protocols for cleaning and how we move. And it's a 45-page document. And it is going far beyond anything we've ever seen, but it is tough. And it's really tough, I think, from agencies from a financial standpoint. That is obviously something we've been concerned about. We are funded by the business community, by the development community. And so for us, it was kind of twofold. We needed to assure them that we would be able to move their employees and tenants safely, but we also needed to be very honest with them what that cost was going to be. And so I think for us, the choice that we had made, and a choice that I think might have been surprising for others that we had worked with, is we refused to put a price on our operators. We refused to put a price on our riders. And that has been pushing every single decision we've made. And I think that is fundamentally different from how we've done transportation funding prior to the pandemic.
That's excellent insight. Thank you, Monica. Well, we got a few questions from the audience, and the first couple really are related to Zipcar, Tracy. People want to hear a little bit about the hygiene measures that you're taking to make sure that the Zipcars that people access are as clean as possible. And I have a few others, but why don't you talk about that, and I'll follow up on.
Sure. So, we're deemed an essential service. So for us, we had to very quickly figure out the safety as a measure, as a first measure, not just of for our members in the vehicles, but also for our employees. So similar to what Monica said, getting access to PPE was our top priority: gloves, masks, sanitizers. And we've gone through a complete overhaul of our cleaning procedures with new products. I think, Monica mentioned, understanding sort of the effectiveness of cleaning is something that we never thought we would have to get into the weeds about, but antiviral and antimicrobial products, ensuring that. So we've changed all of our products that we use. We've issued new protocols for cleaning. And at the same time, because we are a shared member community where the vehicle gets used by multiple members, we've also had to do a lot of education to our membership base around what we expect from them in terms of their level of responsibility. So when they use the vehicle, they should wash their hands, they should bring wipes, and to also follow local guidance. So I think it's a sort of a broader education campaign, if you will, along with our internal protocols that we've really increased and improved over time. So, and that's all sort of been rolled out very early on, and we could really focus on ensuring that our employees are safe, but our members are safe. And so far, so good. I mean, we haven't had a lot of instances of COVID within the relative to size of our member base, which is over 1 million. So that's been sort of a good sign for us in terms of what we're doing to manage the impact.
Mm-hmm. Tracy, the secretary during her slide showed that obviously Uber and Lyft's ridership dropped dramatically. How is your business going in the last?
We've certainly seen a drop off in usage for what I would call leisure activities. I mean, which is not surprising given all the stay-at-home orders. What we have seen is actually a shift to more essential use cases. People going to run grocery store runs, visiting family, sick ones. So really, and also frontline healthcare workers, we're seeing a lot more demand. So it's been nice to get feedback that, because we've seen the business come down, but at the same time, hear lots of great stories of how our members are relying on our service during this very difficult time. So that's been very encouraging. And the other big shift, which I mentioned earlier, is we're getting more and more requests to say, to have access to dedicated vehicles just because they either are a healthcare worker or they don't feel safe taking public transportation. So we've really tried to adapt our services and our pricing to make sure that we're accessible during this period and also for the use cases that have been emerging.
Thank you. Just two other quick questions. One question came from the audience, whether Zipcar is considering increasing your one-way service for the cars as opposed to having to bring it back to the spot where people picked it up, and whether you'll be moving to all electric cars in the near future. Those are the two questions.
Yeah, I mean, I guess for the first one, you know, for now we are still running the one-way service. Unfortunately, it's in London, so it's not going to help presumably someone's asking a question that's local. We are, you know, we're very open to testing it. I don't think that it's going to go live anytime in the near future, unfortunately, in the U.S. You know, but we're testing and learning in London and what that means to have a you know, what we call the floating service, which I think for those of you on that may not know what that means is, you know, the way the Zipcar works is you pick it up from a designated parking spot today and you bring it back when you're done. The one-way model is you pick it up from point A and you drop it off from point B. And this is a service that we've been piloting in London, and it's been successful. And if that works really well and we find that the results are good, we'll port it over to the US as well. And in terms of electric vehicles, we do have electric vehicles in our fleet today. We also have in London a fairly large fleet of EVs. Our vision for the future is that, you know, we will have a much bigger share of electric vehicles. The challenge that we have is really around infrastructure, that, you know, there's always this sort of range anxiety of access to charging stations. And so I think there's a sort of a infrastructure need that we need to kind of get comfortable with. And that's not just on us, but also broadly around the communities in which we operate. But also over time, I think consumers also need to, I think as more and more types of electric vehicles become available on the market, which we are seeing now, we then will consider bringing them into our fleet.
Thank you, Tracy. Next question, Kate, I'm gonna send your way, is a question came in. Many European cities are presently closing some inner city streets for pedestrian and bicycle use only to avoid anticipated vehicular traffic congestion. In terms of, I know Boston in some, I believe in some limited way, I know here in Cambridge where I live, they're talking about doing that. Not only to allow people actually to get around and maybe social distancing and stretch their legs, but in order to address mobility issues. So your thoughts about that?
Yeah, I think, you know, Boston may be a little behind. The city of Oakland here in the Bay Area announced several weeks ago they were going to limit car access to 74 miles throughout the whole city of Oakland to only local traffic. So it's no through traffic of cars is allowed on those 74 miles. And this is throughout the city, including a lot of disadvantaged neighborhoods where there may be people, you know, multiple families living in a home, and, you know, how are, you know, in multiple generations, how are people going to be able to stretch their legs and, you know, have some space without, you know, on crowded sidewalks, and keep a distance. So that's been a very important initiative here in Oakland, and then San Francisco has followed suit. And I got to experience it myself last weekend, biking around, and I saw like a father, you know, teaching his daughter to ride a bike for the first time and in the middle of the street because there was no through traffic. And it just made me think, you know, this might not be happening if these streets were not closed to through traffic. And it's just a very simple putting up cones and barriers. And yeah, you're seeing it across Europe as well. In the short term, but then also thinking about these kind of pop-up traffic calming exercises as also a longer term, potentially infrastructure solution, you know, when funds are available. But there's just simple, cheap things you can do. And I think, you know, Boston would definitely benefit, you know, just to, you know, get people out and be able to have space to walk and bike and also more safely. I mean, I know there's a Vision Zero commitment in Boston to try to reduce or eliminate traffic fatalities and serious injuries. And that can only happen if people feel, people are only going to get on a bike or walk in the street if they feel comfortable and it's safe. And so I think these kind of tools are really important for Boston to consider, and also, for commuting in the longer term as well.
Mm-hmm. Well, thank you, Kate. Monica, I have a question came in from the audience for you. This is someone submitted a question. Prior to the pandemic, I was a frequent rider of a 128 Business Council shuttle. Are you moving toward a contactless system or a reloadable card as opposed to drivers stamping paper tickets?
Yes, we are moving towards contactless. And in the meantime, we are not going to be charging any fares until we get that system on board. And not only are we testing out the technology, but once again, going back to equity, making sure that that technology is available to all of our riders and having backups in situations where they are not. But we will not have our drivers touching anything. The riders do not have to have any sort of physical interaction with our drivers going forward.
Monica, you mentioned earlier that, as you worry about, cleaning your vehicles, making sure your employees are appropriate, are safe and have all the necessary protection, et cetera. You also mentioned like the responsibility that all of us have in terms of follow appropriate social distancing rules, wearing masks, giving 6 feet apart distance, things like that. How have those conversations been with your members in terms of socializing that as employees access your services and as more employees start to come back into the workplace?
Yeah, I mean, it's a huge lift for education. Like I said, we've had a lot of really good, meaningful contact with our members, trying to get an idea of what they're looking at phasing in. But the communication, and this is something our doctors have also said, is actually one of the hardest things that we have to do. And so moving from those protocols, what we're creating is educational platforms, videos showing people how to actually wear the mask, how many times they need to be changed. But the communication's always going to be tough, and it has to be in several different ways. It has to be obviously with our operators, our cleaners, everyone there. We have to be doing a significant amount of education with our riders, and then also the general public and the other companies that we're interacting with. Because like I said, everything is different. The way we board people is different. Where they sit on our buses is different. How they need to behave on the buses are different. We've even set up partitions to block the operators from the general riding public and vice versa. So the education is more about teaching and showing examples, because I think there's been a lot of frustration. Now in the Commonwealth, we are required to wear masks outside. But then when you're outside, you look around, you have people who've tucked masks under their chin, who have let the nose go down, or they take them down to drink water and things like that. And it's because no one has clearly explained to them how you're supposed to use those masks. And I think that was also our biggest concern in giving PPE to our operators, is they need to know how to use it. They need to have enough of it to be able to change it out as frequently as they need to. But the education is the number one thing that we're working on now. And so starting next week, we'll be putting out all of that information, all of those videos and all of that, not only for our employees, but also for companies and their employees, so that they have very clear guidelines and what they need to be doing as they're starting to bring employees back.
Oh, very excellent points. This next question probably is for you, Kate, or Monica, you as well. Modern city planning was born out of public health and sanitation movement of the early 20th century. How will the next era of city planning bear out in the wake of COVID-19? We'll start with you, Kate. Your thoughts, Monica, and then I'll ask Tracy to comment.
Well, that's the $1 million question, isn't it? What's next, and where are we going? And I think it could go a lot of different directions. And I think those of us in the field have a urban planning and transportation a serious responsibility, officials as well as private sector, make sure it goes in a better direction. The old normal wasn't always that great, so let's make the new normal even better. And I think that gets to a number of different different paths that things could go. And I think to, Monica's earlier point about equity, I think this whole crisis has definitely laid bare cracks in the American system in terms of the inequities and disproportionate effects on certain socioeconomic groups. I mean, African Americans, for example, are dying at twice the rates of whites from COVID. And so what can we do moving forward with urban planning to make sure that our cities are safer, more equitable, and more environmentally sustainable? And all of those things, absolutely go together. So I think, I think there's so many different directions it could go, but I really appreciated, again, the Secretary mentioning the climate goals of Massachusetts and how can we tie, outcomes and direction of our planning and our decisions now towards those more sustainable and more equitable solutions.
Monica, would you like to comment?
Yes, I mean, you're entirely correct. Urban planning has often come into play when we've had these public health crises and being responsive. I think as an industry right now, we need to get back to our fundamentals and back to our roots. It really is about how do you build physical spaces that are safe and can guide our residents through them in a way that's going to keep them safe and make sure that we are leaving as much space as possible to maintain the social and physical distancing. But I also think that urban planning historically has also made a lot of mistakes when it comes to this, and that we will focus on wealthier communities first, leaving the tenement houses till last. And I think that's going to be a really big challenge for us as an industry, is making sure that we're creating standards for all of our communities. And I think there's going to be a huge burden here in Massachusetts because we're dealing with unplanned communities for the most part. And so I think when looking at the accessibility, looking at the movement, we're going to have to be very, very specific, very clear, and engaging our communities, very clear and engaging the businesses to make sure that the changes we're making aren't just going to get us through, I think, what people are considering this interim period of, okay, well, we need solutions for the next couple months. So we'll just kind of spray paint this, put some stickers here, and it'll be fine. We really need to be thinking the next 12, 24 months, 36 months, and what sort of permanent changes are we going to make to create the society that we need to try and keep us as safe and as healthy as possible.
Thank you, Monica. Tracy, what are your thoughts on the subject?
Yeah, I think I think this crisis has really proven how interconnected we are in many ways. And I think what I'm kind of most encouraged by and also excited about is really kind of the continued private and public sector partnerships in solving some of these big, meaty issues that aren't just sort of, related to the crisis, but the bigger ones around sustainability and equity, as Monica mentioned. So I think, I think in some ways the crisis may have accelerated some of these decisions and what people get comfortable with, or even changes in behavior, right? In terms of how everyone's adapting to their new normal. And I think that, going forward from a mobility standpoint, from how we operate, I think the types of business models that may emerge and kind of really partnering with the needs of the population at large, and how do we kind of mold together, right? We don't really, I don't think anyone can replace public transit. So, my question from Zipcar's standpoint is really, how do we become a more tighter knit part of that ecosystem of providing mobility solutions to the broader population, and at the same time addressing some of the sustainability goals that are long term and don't go away regardless if there's a crisis or not.
Thank you, Tracy. Thank you, Kate, and thank you, Monica. It's been a great conversation, and I think it's just we have a lot of questions we can't get to, but I'll pass it over to Jim.
Great, and my thanks as well. And Katie, I don't want to let you off the hook. I introduced you as a leader at one point of North America's largest regional transportation network, the New York MTA. We haven't really talked about the role of the federal government, and I know that that was something you were very focused on during your time in New York. Could you just talk about the traditional role of the federal government in supporting all of what has been talked about on this call, and the need for that, particularly in this moment?
Well, I think that the conversation we just had, as well as the secretary and the general manager's comments, clearly point to that this is going to take a multifaceted approach. It's going to require federal government, both in terms of resources, policy development, and guidelines, to make sure that all of these things that come together for the Goldilocks challenge that every city in the United States is facing, to make sure that we have it right. And whether it means, you know, tax credits for people to be working from home, or support for the infrastructure projects that are so needed here in the greater Boston area, and for all the things that businesses are doing to make sure that their employees can get to work easily, but also not contribute unnecessarily to the greenhouse gas emissions challenge that we have. All of those things require the federal government, and working very closely with the states. And hopefully we will get back to that at some point in the United States. It's being sorely tested right now.
Great, thank you. And again, thank you all for participating in this panel. A few closing reflections on my part. I think that as we think about this, challenge of returning to work, going forward, thinking about the short and longer term planning, especially as we think about the T and the important role of public transportation. What I heard today is there's really multiple levels of responsibility and partnership that's necessary. Certainly the T, they're the operator. We heard about cleaning, we heard about worker safety, we heard about creating a safe environment where people felt that way. I think that we'd like to hear more information about what people can expect. Monica used the phrase in her situation of educating riders about sort of what to expect when they take a ride. What are the operating restrictions and policies going to be? So certainly sharing more information, I think, is something that would be helpful. The riders have a responsibility to practice the kinds of things we've all learned to do, right? Wear masks and physical distancing, and bring patients with you as you're rejoining the workforce. Employers have a big responsibility. This focus on telecommuting and how we manage the demand side is certainly a big issue. But as this panel pointed out, even the highest levels of cities that are engaged in telecommunications or work from home is 10%. So there is another 90%. Monica helped define who was in that 90%, and a lot of those are people that don't have a choice. So what are we doing for them is another question. And finally, government beyond the T. Katie Lapp answered the question about funding and the role of the federal government. But the secretary's slide about what will truly make people come back to the T will be testing and a vaccine availability. And I think particularly the federal government has a very powerful role in supporting private sector scientists who are working on this and getting us to the volume of testing and the vaccine. So agree wholeheartedly with the secretary's suggestion about partnerships, and I think that there's a lot of partnerships involved. Thank everyone again for participating in this panel and for joining us today. Two quick upcoming commercial messages. Our next webinar in our focus on the future of Boston will take place on Monday, May 12th at 1 p.m. It will focus on technology and innovation. It'll be Tuesday, May 12th at 1 p.m. and it'll be co-hosted between the Chamber and MyTex. And on May 21st at 2 p.m., we'll be hosting a government affairs forum featuring Speaker of the House, Robert DeLeo, to give us some insights into the workings of the House of Representatives and how they are moving forward, particularly in this time in which state revenues have certainly taken a deep dive in this moment. You can register for those programs and learn more about what's going on at the Chamber at bostonchamber.com. Once again, thank you all for joining us today, and that concludes today's event.